Thanks for staying with us. So, Global Citizen working with the Lagos state government to create a limited capacity event to celebrate Nigerians working on the front line in the fight against the COVID-19 pandemic, and to help ensure that 1 million people are vaccinated as soon as possible. Joining us on the show now is Dr. Fejiro Chinye Uwoko, the General Manager of NSSF. Good morning, are you there? Dr.
Good
Fejiro.
morning.
Oh, goodness, I cannot hear you. It's so hard to hear you. Can you hear me now? I can see your face, but the volume is pretty low.
And I can hear you clearly.
And she can hear us.
Okay, so tell us about your organization's drive to, in fact, let's start with the impact of COVID-19 in Nigeria. How far have we gone concerning vaccination, and what do you hope to achieve going forward concerning vaccination?
Thank you so much. I hope you can.
Yes, we can. It's clearer now.
Okay. Yes, thank you. Okay, so COVID-19, it's now home with us. It's no longer a new pandemic anymore. It's over a year old. That it has come to sort of revolutionize the world, and we're not the only ones going through and working through it. It has changed the way we see life. It has changed the way we live life. Before COVID, now the common term is to have before COVID and to have after COVID, because things have drastically changed. But one thing that we have seen over the months battling this pandemic is that we are more resilient. We are changing. We are innovative. We are very accessible to change. We are very volatile to change. We are able to change the way we socialize, the way we work, the way we dress now, having all the face masks and all on. So we, as human beings, it has tested our ability to adapt, and we are adaptable. And so with the COVID pandemic has come also the sensationalizing everyone to know that we are one people, and we are no longer living in silos. And it has brought unity, especially unity with like minds, to come together to solve the problem. And NSSF is one of those people that have come in the platform alongside other organizations to say, what can we do? How can we help others? How can we alleviate the impact of COVID in Nigeria?
Right.
And so that's why we're here today.
Okay.
Okay, so what is the NSSF doing to help Nigerians cushion the effects of COVID-19 pandemic?
Okay, so NSSF is a non-for-profit organization. It's an initiative of the Global Citizen, which is an international non-for-profit, and Nigerian Sovereign Investment Agency, NSI. NSSF was really bettered to achieve 3 main objectives, and the first is to care for the vulnerable population. The second is to strengthen the health systems, and lastly is to reskill the Nigerian youths. What are we doing in terms of COVID? All these 3 objectives are to help strengthen help alleviate the impact of COVID-19 on Nigerians. And our first focus for this year and next is actually to help vaccinate Nigerians. Our singular message this year is that we want to get more Nigerians vaccinated against this coronavirus. And what we're doing is a 2-pronged approach. The first is to partner with other organizations to increase vaccine supply in Nigeria. We know the debate about vaccine equity around the world, and we know that based on resources, we're not able to get as many doses as we would like for the population of Nigeria. So we're working and partnering with other organizations to get in more vaccines. And secondly, what we want to do is to push these vaccines, knowing fully well that there's one thing to solve the supply side, but there is the demand side. So we want to increase demand for vaccinations. We want to reduce the vaccine hesitancy that we see in Nigeria and make sure that more people are vaccinated, not for the sake of vaccination, but they are vaccinated so that they can be protected against the virus and they can protect others from this deadly virus.
What methods? Sorry.
You mentioned Global Citizen Life. So who are the supporters of Global Citizen Life?
Okay, what I mentioned was Global Citizen. Global Citizen Life is an activity that is going to happen this month, September 25th. Global Citizen, it's an international organization. They are the ones that are coming up with Global Citizen Life, and the idea is to get get the world, really, it's a 24 hours live event to get the world, to rally the world together to alleviate the burdens of COVID-19. And their first objective is actually climate change, and the second objective is to reduce the vaccine equity issues around the third world nations and developing countries. And lastly is for gender-based violence. Right. And so they've come up with this 20 hours event to create awareness, to rally around donors together to put their hands on the plow and support this cause of ending the pandemic and being resilient after the pandemic.
Yes, Nima.
So I wanted, when you were talking about getting people vaccinated, I wanted to understand what incentives. I believe that incentives are better at getting people to do it than these punitive measures promoted by some states. And now most people are afraid. If you probably had incentives, what methods do you want to use? And what incentives, if you had incentive as one of your methods, would you propose?
Okay, so when you talk about incentives, what are the benefits for someone to get vaccinated? We understand that it's not only Nigeria that's going through this vaccine hesitancy problem. It's everywhere in the world. People that are really skeptical about taking the vaccines. But one way NSSF is trying to increase vaccine uptake and reduce this vaccine hesitancy is education. So educating people to see that the vaccines actually protect you against the virus. The most important benefit of taking the vaccine is that you are protected against the virus and against the deadly outcomes of the virus. And it's not just you, you're also protecting those around you that are not vaccinated. So those that are vulnerable but are not yet vaccinated, you being vaccinated, I being vaccinated, we also prefer that protection against those group of people that are vaccinated. And secondly, the way we want to do it is to go into the communities. There's one thing to educate people from the urban areas, sitting in the television and not understanding, where they're coming from. So that when we go to the communities, we understand their mindsets. Behavioral change takes time, and social change takes time. So we have to be patient. We have to see the issue from their lens, and with time gain confidence. So we'll be going into the communities, especially communities of vulnerable Nigerians, to campaign for vaccinations.
Dr. Pedro, let me be sure that I understand. So the Solidarity Support Fund, you're going to work with donors to get the vaccines into Nigeria. So are you also going to help to distribute, or are you just going to educate people? Because when people hear fund, their ears are thinking, they want to collect money on our behalf. So what you're doing, let me be sure I'm clear, is that you're getting the funds from these donors. Are you going to be handing those vaccines over to the government to distribute, or you plan to distribute yourself, or to actually administer the vaccinations yourself?
Okay, the primary goal of NSSF is not to create parallel structures. I think that's another thing that we are learning with COVID is that we can partner together, we can collaborate, and we can gain more grants collaborating. So we will partner with organizations to get in these vaccines, but we'll also partner with the government, seeing that the federal government is at the forefront of receiving vaccines and distributing vaccines. We're going to be partnering with the government and the agencies that are responsible for distributing these vaccines to make sure that these vaccines get to the people that need the vaccines, especially the people that need it the most, which is the vulnerable population. So we will work with them. We're not going to, do it on our own. We're not also going to, just educate people we're not just doing that, we're also going to support the government to distribute these vaccines to this community.
All right, we have to run up with, but what's your target numbers? What numbers are you looking to vaccinate in the next coming months?
Okay, as an initial target, we're aiming to vaccinate 1 million people, 1 million Nigerians, but we know that is an initial target. And once we hit this target, we definitely will go to vaccinate more people, because we are aiming to vaccinate 80 to 90% of the population in Nigeria to give us that herd immunity where we can protect the other 10% and 20%. So 1 million is just is yet a drop, the first drop in the ocean.
All right. Any final words? We have to wrap. Any final words, Dr. Fejiro?
Okay, so for NSSF, we see the magnitude of the gap, and we don't want to sit on the sidelines and complain about the issue, and or just talk about the challenges and analyze the challenges. We want to do something, and to every Nigerian that has something to give, be it a corporate organization, be it an individual that wants to help Nigeria. We are Nigerians for Nigerians. We're not waiting for our help to come from somewhere. We want to help Nigerians as Nigerians. I would advise that you go into our website, learn more about NSSF, see our framework of governance, see our framework of accountability, and know that we are trusted organizations, and partner with us to effect the social change that we're looking to.
Thank you very much. We've been speaking with Dr. Fejiro Chin Ye Nwoko, the General Manager, NSSF. Thank you very much, madam, for joining us. Let's go on a quick break. When we return, we move on to our hot topic of the day. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.